KNUST-TEK TV. Experience educational television.
My name is Kwame Ohenimboabi. I'm an associate professor in the Department of Pharmacy Practice. I'm also a clinical pharmacologist, and on the Antimicrobial Resistance Coordinating Committee of Ghana, I am the deputy chair. The question, what does antimicrobial resistance mean? When we say antimicrobial resistance, it's a phenomenon where microorganisms that causes infections, become resistant to anti-infective agents, that are used for treating the infection, such that, when you use these agents on the microorganisms, these agents are not effective, the infection gets worse, and is associated with significant mortality, associated with significant ill health as well, and is also very, very, very expensive. And I think a couple of weeks from now, we are going to, launch this year's, awareness, and a lot of educational programs, community engagement and educational program is going to go on, so that the community understands the problem. Because that's one challenge. A lot of people are not aware of this, and that is why we keep on using antimicrobials, anyhow. They are also, working together with various institutions. They're working with national, individual, national, and they've actually supported them to develop national action plan, which has 5 major pillars. One of the pillars, is about awareness creation, and then another important pillar is infection prevention and control. Another pillar is trying to understand, using science, to try to understand the extent of the problem and how the problem can be tackled. It's called surveillance, trying to know which the various organisms that are resistant and strategies that can be adapted, in containing this. And then we also have antimicrobial stewardship, ensuring that antimicrobials are used rationally in the community, in the hospitals, in animal health, etc., etc. And finally, and I'm very happy that I am sitting under the green shade and I'm facing the physics gardens. The antimicrobials, we need more newer antimicrobials, and one of the areas is natural, what they call it, sources, trying to get new products from natural sources, and also being innovative in our approaches, in developing new antimicrobials plus diagnostics to be able to understand, the issue of antimicrobial resistance. And Ghana has also developed, we have developed our national action plan with support from the international partners, and all the universities in the country, through their research activities in this area, were involved in generating evidence, to develop national action plan, which is also in line with these 5 pillars, 5 strategic objectives.
My name is Dr. Alex Osofori. I'm a senior lecturer in the Department of Clinical Microbiology and head of the microbiology lab at the Komfanochi Teaching Hospital. So currently in Komfanochi, we are taking steps to try to combat this problem of antimicrobial resistance. The hospital management has recently set up an antimicrobial stewardship committee. Now, this committee is to lead activities in the hospital that will seek to reduce the spread of resistance. Beyond the committee has also formed teams within the different directorates. Within these teams, you find a doctor, a nurse, and a pharmacist, and they are supposed to coordinate activities in the directorates that will help to regulate use and also curb irrational use. So within the directorates, the teams will coordinate these activities. They will monitor the rate of antibiotic use. They will ensure that antibiotics are used only after cultures have been taken for the microbiology lab to determine which organisms are present and which antibiotics are best suited for these organisms. So in summary, steps are being taken to ensure that this fight against antimicrobial resistance is won on a national scale, and that is how Komfanochi is getting involved.
Oh, my name is Dr. Mrs. Cynthia Ameni Dankwa. The World Antimicrobial Awareness Week, WAAW, is here with us once again. Every year, 18 to 24th November, is dedicated to creating awareness on antimicrobial resistance. This year, the global theme is Spread Awareness, Stop Resistance. It is the responsibility of all of us to educate all and sundry on the menace of antimicrobial resistance, which is still a global health challenge. We would want to encourage all not to abuse, especially our antimicrobials. Do not share your antibiotics with your colleagues, your family, or your friends. The symptoms they have may be similar, but not the same as yours. So don't share antibiotics with them. Make sure that you complete the course of your antibiotics as prescribed by the physicians. Encourage your family and friends and colleagues to wash their hands regularly. Let us all play our part as we in our research to discover new antimicrobials are also playing our part. So at the Center for Drug Discovery at KNUST, we are looking for new compounds from natural products, especially plants, that can be further developed as drugs to tackle antimicrobial resistance. So spread awareness on AMR and let us stop the resistance. Thank you very much.
So my name is Dr. Linda Aurelia Ofori, a member of faculty at the Department of Theoretical and Applied Biology, with a special interest in antimicrobial resistance in Salmonella and Enterobacteria in both animals, humans, and the environment. As we commemorate this year's Antimicrobial Resistance Week, we wish to let the general public be aware that resistance to these antimicrobials, be it in animals, in humans, and in the environment, is on the increase, especially in Ghana, making us one of the hotspots for antimicrobial resistance monitoring. This means that our level of use and misuse of antimicrobials is high, and that is what is causing the resistance. The resistances most of the time happens not because of too much use alone, but sometimes the abuse of these antimicrobials. Because studies have shown that our poultry, our pigs, our cattle are being dosed with these antimicrobials, all in the interest of getting them to grow faster, or to prevent diseases, or even to treat disease. And these ones end up getting into humans and further complicating our already burdened health system. We are asking that we will be very cautious and use these medicines with a lot of caution. I've done a lot of studies on poultry, a lot of studies on farm animals, and these antimicrobials are used a lot without adhering to the withdrawal periods. We would advise our farmers to please insist on the withdrawal periods where animals or eggs are not used during the period where these animals are on medication. Let us also, who are sick and attend hospitals, insist on finishing the course of treatment that are given to us by our doctors, so that we do not expose these microorganisms to the antibiotics and then stop halfway, leading to the buildup of resistance. Let us all be cautious and let us all think of one another so that we'll be able to monitor our resistances and not complicate our own lives in the near future. Let's enjoy ourselves and keep safe. Thank you.
is Obed Amponsam. I'm in the Department of Pharmacy Practice in the College of Health, KNUST. One of the key areas where we use the most antimicrobials, especially antibiotics, are hospitals, where we use them to treat all sorts of infections. Now, they are also one of the key areas where antibiotic use is potentially inappropriate, potentially excessive, contributing to the development or the rapid progression of antimicrobial resistance AMR. So we have conducted various research personally. We have worked on measuring the consumption of antibiotics in the Ashanti region in 3 facilities. And we found it to be quite high, 60% on average, compared to the WHO's recommended 30%. Now, we also found key targets for improvement to help us to be able to rationalize antibiotic use, antimicrobial use in these facilities, so that we are able to slow down the progression of antimicrobial resistance. Various research works are being conducted in the whole of the university, in taking the One Health approach that the WHO, the World Health Organization, recommends in animal health, in agriculture, and in human health. And all of these are geared towards fighting or slowing the progression of AMR in Ghana. We know that there's constant misuse of antibiotics on the open market, in pharmacies, and generally among the public. And of course, we are trying to create the awareness so that all of these are reduced, so that we do not misuse them, we protect the vital resources that we have. Because truly, our antibiotics, the rate at which we are losing them to antimicrobial resistance, it's not matching up to the new antibiotics that are being developed. So we need to protect what we have. Spread the awareness, stop the resistance.
Spread awareness, stop resistance.
Tech TV. Experience educational television.